that helps Coloradans pay their medical bills has gotten $10 million back for them. Otherwise, patients would have had to pay out of pocket.
Our Angeline McCall introduces us to one man who used the program, and it helped him keep his house.
Other ones, and again, I paid these.
After $500,000 worth of medical bills,
But there's these,
Glenn Hayes would describe his situation differently than most.
it sounds weird to say, but I've actually been lucky. Because what happened, like I say, 80% of the people don't survive it. It's very, rare, and it's kind of serious.
In January, Glenn's aorta split open. It's the main heart vessel that carries blood to the rest of the body.
You hear these horror stories. People have medical horror stories, and I figured, well, I'm now one of them.
After several surgeries, a hospital stay, and post-injury care, he was left with a bill.
They sent me a bill for $20,000. I'm like, okay, I'll pay it.
That bill turned into $60,000, then $543,000.
You don't send a bill like that to somebody with a weak heart without some warning, for heaven's sakes. They could have done me in right there.
Glenn planned to sell his house to pay his bills until he heard of Colorado's Consumer Assistance Program.
What we've noticed is that there's been an increase in hospital billing overall that seems incorrect, or patients are having a hard time affording their own medical bills in general.
Priya Talang with the Colorado Consumer Health Initiative said they've stepped in for people like Glenn to negotiate down payments, correct when bills shouldn't have been sent at all, or help them find programs to help pay.
Overall, we've had a huge increase in our caseload this year.
The need has gone up 24% since 2023.
We've been doing this for now 6 years, and we just reached $10 million in savings, which is both amazing and disappointing in the first place that we have to be here for consumers to do this work so that they aren't saddled with medical debt.
In Glenn's case, they helped him discover he was in fact eligible for Medicaid, meaning all of his bills would be covered.
Inexplainable. The words aren't there. Just it was such a relief to have that lifted.
It was something more than luck that saved him more than just money in the end.
So yeah, they saved me over $500,000. I'm still in my house, not having to live in my brother's basement. I think that's a great thing.
Glenn said that he had spent time trying to negotiate down the payments on his own. He'd actually started a payment plan, and he actually began paying it as well. And then through this program, he was encouraged to fight an initial Medicaid denial. He said if it weren't for that guidance, he would have never appealed and realized that he was, in fact, eligible.
Yeah, because how do you know? I mean, there's no way you know, and you're just freaking out like he is, like sell your house. But it's the way the billing has changed and the hospital systems too.
Yeah, it's really hard to navigate as a patient, right? And so something that the CAP program has actually noticed is that they've actually seen healthcare systems billing high or billing in cases where they shouldn't bill at all, meaning that patients are really sort of shouldering a large cost that they shouldn't otherwise be dealing with. Also saying that consolidations are increasing medical bills as well. And so that's a big part of this, right? We know that.
We see about that all the time.
Yeah.
$10 million saved, that's a lot of money. Angeline McCall, appreciate it.